How does optic neuritis affect the optic nerve-brain connection? Imagine your eye sending signals to your brain like a busy highway carrying important messages. When optic neuritis occurs, it's like a roadblock that slows down or stops these messages from getting through properly. This condition is caused by inflammation that damages the optic nerve, which is the main pathway for visual information traveling from the eye to the brain. The problem mainly lies in the myelin sheath, the protective fatty covering around the nerve fibers. When this sheath gets inflamed or damaged, it can no longer insulate the nerve properly, making electrical signals slow down or become disrupted. This disruption means that the signals from your retina, which is the part of your eye that detects light, don't reach the brain as they should. As a result, you might experience blurred vision, difficulty seeing colors clearly, or even partial loss of your visual field. Sometimes, moving your eyes can cause eye pain or discomfort, especially during an attack. The nerve's job is to carry impulses generated by the retina through a series of neurons to the brain's visual centers, including the part called the primary visual cortex. When the myelin is damaged, these impulses are slowed or blocked, leading to sudden and sometimes severe vision loss in one or both eyes. But the effects of optic neuritis go beyond just the eye. Because the optic nerve connects to the brain's visual networks, inflammation can also influence how your brain processes what you see. Research shows that during an episode of optic neuritis, there can be changes in how different parts of the brain communicate with each other. This means that the condition can affect not only the eye's ability to send clear signals, but also how your brain interprets and integrates visual information. Optic neuritis is often linked to neurological conditions like multiple sclerosis and neuromyelitis optica spectrum disorder. In fact, it can sometimes be the first sign that someone has multiple sclerosis, making early detection and treatment very important. The inflammation and nerve damage seen in optic neuritis mirror similar processes happening in the central nervous system, which is why eye health and brain health are so closely connected in these diseases. In summary, optic neuritis affects the connection between the eye and the brain by damaging the myelin sheath around the optic nerve fibers. This damage slows or blocks the transmission of visual signals, causing visual problems and sometimes pain. It can also alter how the brain processes visual information by changing the way different parts of the brain communicate. If you experience sudden vision changes or pain, it's essential to see a healthcare professional promptly. Early diagnosis and management can help preserve your vision and address any underlying neurological issues. Always remember, individual experiences can vary, so personalized medical advice is key to proper care.